To begin with, I think I'd just like to welcome all of our participants and speakers this afternoon to the Health Workers Public Forum organised by the Socialist Equality Party. My name is Max Boddy, and I'll be chairing this meeting today. We have an important lineup of speakers who I will introduce soon, and we encourage the broadest possible discussion and questions from everybody participating. The forum today has been called to discuss the announcement of the Global Workers Inquest into the COVID-19 pandemic, initiated by the World Socialist Web Site on the 24th of November and supported by the Socialist Equality Party and our sister parties internationally. The inquest will investigate and document the disastrous response of governments worldwide to the outbreak of COVID-19. It will seek to expose the political and economic forces which allowed for the unrestrained mass spreading of the virus through the homicidal policies of herd immunity. It will seek to gather interviews and information from scientists and public health experts on a global scale, and critically, it will also draw on the real-world experiences of workers and students to document the impact of the virus on ordinary lives. The origins, causes and consequences of the pandemic will be thoroughly documented, and this is necessary to cut through the lies, cover-ups and outright falsification being used to justify the removal of even the most basic measures to halt the spread of the pandemic. It will refute the lie that when the pandemic began to spread, there was nothing that could be done to stop it. Now, the editorial board of the World Socialist Web Site wrote in a statement, quote, "The launching of this inquest cannot be delayed. As the world enters the third year of the pandemic, the global contagion is not abating, far from it. The sixth global surge of the pandemic is now well underway, with cases, hospitalizations, and deaths once again on the rise as winter approaches in the Northern Hemisphere," end quote. Officially, there have been nearly 270 million confirmed cases of COVID, with more than 5.3 million deaths. But these official figures are massive underestimations. By measuring excess deaths, the total number of deaths attributed to COVID-19 is more than 12.1 million. In fact, it is possibly as high as 17.5 million, a number greater than the higher estimates of military deaths suffered during the First World War. While powerful vaccines have been manufactured, the majority of the world's population have not had 2 doses, and only a minuscule percent have received a 3rd booster. As the statement continues to say, quote, "Scientists have repeatedly warned that continued mass infection amid the slow rollout of vaccines creates evolutionary pressures that threaten to produce a vaccine-resistant variant," end quote. Now, this prognosis was vindicated less than 5 days after the publication of the statement, with the World Health Organization designating a new variant of the SARS-CoV-2 virus, dubbed Omicron, on the 26th of November. 2 weeks since that announcement, it is clear that the world has entered a new and more deadly stage of the pandemic. More than 60 countries have confirmed the variant's presence. Many already have community transmission, including Australia. It is spread exponentially in South Africa, the UK, and Denmark. Within days of the announcement of Omicron, it's been known that it is more transmissible than the Delta variant. And studies have now proven that having 2 doses of the vaccine makes you almost entirely unprotected against Omicron. Yet the response by capitalist governments has been to peddle the false claims that it is a milder variant. This is to justify the continued reopening of the economy. Nothing is to get in the way of the profits of big corporations, particularly in the lucrative Christmas season. The International Committee of the Fourth International, of which the SEP in Australia is its Australian section, raised in March of 2020 that the pandemic was a trigger event like that of the assassination of Archduke Ferdinand in 1914, which led to the First World War. Now, young soldiers in that time being shipped off to the trenches were told that the war would be over by Christmas. Instead, the war continued year after year. While the first 2 years saw horrific bloodbaths, the third year, which began in the summer of 1916, saw the scale of death increase to unthinkable numbers. Likewise, the pandemic was not over by Christmas 2020. nor now, at the end of 2021, after a year that saw more deaths than the last, the world is poised to enter a third year of the pandemic, which is going to be even more deadly by all accounts, with Omicron, a new, highly contagious vaccine-resistant variant, and the governments internationally declaring the end of all measures to protect the population. The most important comparison to the First World War is how it was ended. It was through the intervention of the international working class, which finally ended the bloodshed, most consciously expressed in the Russian Revolution of 1917. The experiences of this past year have proven that the ending of the pandemic is not primarily a medical question, but a profoundly political one. Omicron again demonstrates that the strategy of the global elimination of the virus is not merely preferable, but absolutely necessary to end the pandemic and save millions of lives. This strategy can only be realised through a mass social and political movement of the international working class, and it is to this intervention of workers that we turn in this period, the only social force capable of bringing the pandemic to an end, as well as the capitalist system responsible for its worldwide spread. With those opening remarks, I'm proud to introduce our two speakers for today. Our first speaker will be Gary Overnia, a junior doctor and writer for the World Socialist Web Site. Gary will speak on the spread of Omicron, the launching of the Workers Inquest, and the situation here in Australia. And our second speaker is Richard Tyler, a member of the Socialist Equality Party in the United Kingdom. He will discuss the situation in the UK, particularly the impacts on parents and educators and the attacks on the National Health Service, or NHS, as the Omicron virus spreads rapidly and out of control. After those speakers, we will open up for discussion, as well as questions and answers. Following the Q&A, we will open up for an appeal to our monthly fund, make some announcements of our Christmas book sale, and discuss our ongoing campaign we have launched against anti-democratic electoral laws, which are designed to stifle opposition to the major political parties from finding a left-wing political alternative. So, as I said, with those remarks, I would like to introduce our first speaker today, who, as I said, is Gary Overnia. Now, Gary is a member of the Socialist Equality Party's National Committee. He writes for the World Socialist Web Site, concentrating on topics on the crisis facing the public health system and the impact on health workers. He is a junior doctor currently working in the health system, so as such, he will not have his camera on today during the report, but I would like to warmly welcome Gary, as I said, our first speaker today. So welcome, Comrade Gary.
Thank you, Comrade Max. In the 21st century, humanity's scientific and technological capabilities have made it possible to identify new diseases in a matter of hours, initiate international quarantines in days, build 1,000-bed hospitals in weeks, and create vaccines and life-saving treatments in months. In this era, the horrific death toll of COVID, borne overwhelmingly by the international working class, is the result of a criminal conspiracy. That crime is the lie that COVID cannot be eliminated and that workers must accept disease and death from COVID as it spreads unrestrained throughout their communities in order to protect the economy, which really means protect corporate profit and exploitation. In policy, it is called herd immunity or living with the virus, and it has no basis in science. Nevertheless, it has been the policy of nearly all capitalist governments since January 2020. Even before the Omicron variant emerged, the world was experiencing a fourth wave of the pandemic, with daily case numbers doubling in the past 2 months globally as countries abandoned COVID lockdowns and travel restrictions. But the Omicron variant will not change the plans of the capitalist billionaires and their government servants. Left to them, the infections and deaths will only rise. COVID is a natural virus, but the devastating pandemic is a capitalist political crime that requires a socialist political response. To expose these crimes and mobilize the working class for the international elimination of COVID-19, the World Socialist Web Site, the international publication of the World Trotskyist movement, called for a Global Workers Inquest into the COVID-19 pandemic on the 21st November this year. This call has only been vindicated and made more urgent by the Omicron variant. Identified only 3 weeks ago, it is the most transmissible, infective, and possibly deadliest variant of COVID to date. This is not an exaggeration. Since its discovery in South Africa, it has led to an unprecedented 90-fold increase in the rates of COVID cases there, with a weekly average increase of 250%, spreading about 4 to 6 times more rapidly than the Delta variant. It is now in at least 60 countries, triggering superspreader events wherever it emerges. Omicron can avoid the immune system far more than previous variants. Reinfection rates in South Africa have increased 3-fold, and the effectiveness of 2 vaccine doses has fallen as much as 40-fold compared to the original COVID variant, guaranteeing breakthrough infections. South Africa has experienced a 400% rise in hospitalizations in the past week, and most disturbingly, young children are forming a greater proportion of patients, overwhelming children's hospitals. In the populous Gauteng province, which includes Johannesburg, the incidence of COVID in children under 5 is second now only to those older than 60. Children aged 5 to 14 make up the largest group of Omicron patients in Europe, and children now comprise 22% of all COVID patients in the United States. Unable to be vaccinated, infants and very young children are now the most vulnerable group to the pandemic. The larger number of mutations on the Omicron variant's spike protein, at least 32 mutations versus 7 on Delta, massively increases the odds that ever more transmissible and deadly variants will emerge. In an interview with the Financial Times, Mrna CEO Stefan Bancel made clear the fears held by much of the scientific community. He said, and I quote, "There is no world, I think, where the effectiveness is the same level we had with the Delta variant." Then added, "I think it's going to be a material drop in effectiveness. All the scientists I've talked to are like, this is not going to be good." He said scientists had not expected that such a highly mutated variant would emerge for another year or 2. Despite the clear danger, the response to the Omicron variant by capitalist governments and institutions has been to continue the same homicidal policy of herd immunity. An emergency meeting on the 29th November of the health ministers for the US, UK, Japan, Italy, Germany, France, and Canada produced only a short 200-word statement that urged no action, only monitoring and sharing information on Omicron. US President Joe Biden, who won the 2020 election by criticizing the anti-scientific and murderous policies of Donald Trump, vowed to, quote, "reopen our country, reopen our businesses, and reopen our schools." At least 800,000 people in the US have died of COVID, and more people have died under the Biden administration than Trump, as the Democratic president follows the same course as the fascistic billionaire. UK Prime Minister Boris Johnson, infamous for demanding, quote, "no more fucking lockdowns, let the bodies pile high in their thousands," also refused to halt the spread of Omicron, despite acknowledging its danger and now confirmed ability to evade vaccines. As a result of the anti-lockdown policies of Johnson, supported by the opposition Labour Party, the UK has experienced 10.4 million cases and at least 146,000 deaths, twice the number of its civilians killed in the Second World War. Regardless of party, the Australian ruling establishment plans to do the same. While last year, Australian federal and state governments responded to the immense pressure placed upon them by the working class to suppress the spread of COVID, they have now discarded even the pretense of elimination. As a result, the country has gone from virtually no COVID cases within its borders to over 1,000 cases per day for several months, with a total of 225,000 cases and over 2,000 dead. Omicron cases have been detected in every state and territory except Tasmania and Western Australia. It has led to a doubling of daily COVID cases in New South Wales in barely 1 week, which now has over 500 reported cases per day, its highest level since early October. Yet officials have downplayed the severity and danger of Omicron, refusing to reinstate lockdowns. Chief Health Officer Paul Kelly has repeatedly claimed, without proof, that the Omicron variant may be less deadly than Delta, and supported its spreading in Australia as a means of developing herd immunity, a thoroughly discredited and dangerous concept. Quote, "I said that would be my number one Christmas present, and it would be if that was how it ended up." Such baseless assertions were repeated by former Deputy Chief Health Officer Nick Coatsworth. He wanted to outcompete Delta and become the predominant circulating virus. It could be that we want Omicron spread around the world as quickly as possible. This week, Coatsworth opposed urgently vaccinating young children against COVID, saying parents should not feel under any pressure at all to get their kids vaccinated. These are not the complacent speculations of the ignorant, but calculated statements by high-ranking government officials, designed to lull the population into a false sense of security. After initially refusing to implement any travel restrictions, Federal Health Minister Greg Hunt announced a belated and inadequate travel ban only on Southern Africa. Dan Andrews, Labor Premier of Victoria, summed up the attitude of the state governments, who have refused to implement lockdowns and are proceeding with border reopenings and ditching quarantines. He said, "We will not be pursuing an Omicron zero policy here. We don't think that makes any sense." The Australian healthcare system will be rapidly overwhelmed by the resulting surge of COVID. Even before the pandemic, the public hospital system was on the verge of collapse. Decades of underfunding have resulted in public hospital beds remaining stagnant for 8 years. And for people aged over 65, the group most at risk of dying from COVID, the ratio of older persons' beds has declined for 27 years. Under the pressure of COVID outbreaks since March 2020, thousands of healthcare workers burnt out and resigned their positions, too exhausted to continue. That loss of staff means Australia now has 200 fewer ICU beds, 8% fewer than when the pandemic began. In New South Wales and Victoria, elective surgeries and clinic appointments were indefinitely delayed or cancelled, as all available staff were diverted to COVID wards or unable to perform their work safely. Ambulance ramping reached such severe levels that patients were dying in ambulances outside hospitals unable to get treatment. A similar situation exists throughout the country, even where COVID has not yet reached crisis levels. With Australia scheduled to fully reopen to international travel, and without lockdown measures to stop the spread, Omicron will cause mass infection, death, and long-term complications for survivors, such as long COVID. COVID is far too lethal, transmissible, and rapidly mutating to live with. The virus threatens global society, demanding an international system of quarantines and lockdowns, with financial and material support for working people so that they are not impoverished or isolated, combined with a massive global vaccination program to protect the world's people. To the ruling elite, however, it is not COVID that represents the greatest danger, but rather the demands to eliminate the virus. The diversion of society's wealth to the interests of saving the international working class, indeed the human race, from a deadly virus represents an intolerable drain from the stock portfolios of the super rich and their financial institutions. The vaccination program itself has been subjected to the profit motive. That Omicron emerged in Africa is in part due to the abysmal vaccination rates in that oppressed continent, which remain in the single digits for most of its nations. Even as the need for boosters becomes evident, the entire continent of Africa will receive just 470 million vaccine doses of the 2 billion needed to vaccinate its population this year. This is not an accident. In the same interview with the Financial Times, Mrna CEO Bansal revealed that the US government had demanded that 60% of Moderna's vaccine doses be delivered to the US only, and similar demands were made by the Western European powers. The Global Workers Inquest has nothing in common with those in the corporate media who call for a 9/11 style commission. Not a single government will tolerate any serious investigation because they themselves are implicated in this massive social crime. Drawing upon the research principal scientists, the knowledge of public health experts, and the real-world experience of working people and students, the inquest will investigate and document the disastrous response of governments, corporations, and the media to the pandemic. It will demonstrate that the pandemic was entirely predictable and that elimination is both necessary and achievable. The experience of China demonstrates that elimination is possible. Despite being the first country in the world with a major COVID outbreak and with a population of 1.4 billion people, China was able to eliminate the virus within its borders through use of masking, social distancing, testing, contact tracing, the closure of non-essential workplaces, and the rapid construction of healthcare facilities. There have only been 4,700 deaths from COVID in China. Similar measures were implemented in New Zealand, Vietnam, Taiwan, and other countries in the Asia-Pacific region with great success. Already, the inquest has already brought to light invaluable testimony. Nicholas Smith, expert in COVID masks and respirators, courageously revealed the decisions made by the US government to withhold N95 and elastomeric masks from healthcare workers, all but guaranteeing increased rates of workplace COVID infections.
Even in 2003, because scientists didn't know how SARS spread, the CDC on their website explained that surgical masks should only be used as a last resort since the spread of airborne transmission couldn't be ruled out. And then they did find out that it was airborne, which is why that precaution was should be taken. And that's why so many lives were saved during SARS and H1N1, and why so many lives were put at risk and lost during COVID. And during SARS and H1N1, N95 alternatives were also recommended. So N99s, N100 respirators, P100s, and even elastomeric respirators, they weren't only recommended. The CDC explained that they offered better protection than N95s. So somehow a lot of the valuable information that kept so many people safe during the last pandemics were hidden from the public and ignored. And then new information was coming out, such as N95s is the only option, even though they knew that that was a lie. For example, in January of 2020, the Trump administration was warned about the shortages of surgical masks and N95s, but instead of acting, they decided to silence the people that were sending these warnings out. And when the people such as Rick Bright blew the whistle, I believe it was in April of 2020 about it, they actually lost their jobs and were punished by the government for telling the public the truth, and that the public had advanced knowledge of the problems and actively avoided letting the people know. And in February 2020, on February 9th, the CDC had a webinar, and then they told hospitals that to plan for the N95 shortages and to plan for it, that they should be using N99s, N100s, P100s, and elastomeric respirators. And even Trump himself, he was interviewed by Bob Woodward, and unfortunately, Bob didn't let anybody know about this until months later, which could have changed the trajectory the pandemic took. But Trump admitted, he said, it goes through the air, Bob. That's always tougher than touch. So how many problems would have been fixed if the world would have known from the start that the government knew it was not touch and that it was airborne transmission?
That was also that phone call to Bob Woodward came after Trump had received a call earlier that day from Chinese President Xi Jinping. So he was basically conveying what the Chinese authorities, knew, and they were well aware of it in the White House and the political establishment in the U.S.
The same decisions have been made in Australia, leading to thousands of workers becoming infected. Globally, the WHO estimates that as many as 180,000 health workers have died of COVID. We call upon all health workers, scientists, and those who have had experiences with COVID to come forward and participate in the work of the inquest. Workers are not accepting the devastation of COVID lying down. Like the violence and death of World War I, COVID-19 is a trigger event which reveals the bankruptcy and inability of the capitalist system to address the basic needs of humanity, including life itself. Determined not to allow children to be the victims of COVID, there is growing opposition from parents, teachers, and students against the drive to force students back to in-person learning and inevitable infection. In the UK, parent Lisa Diaz has launched an ongoing series of school strikes. For her principled stand, Diaz is being persecuted by UK authorities, seeking to make an example of her and intimidate others into silence. The World Socialist Web Site has launched an international campaign defending Diaz, and we urge everyone here to get involved. Last Monday, New South Wales teachers went on strike for the first time in a decade, along with Sydney rail and bus workers. Though limited by the unions, the strikes reflected the immense anger at worsening work conditions and the dangers of COVID. Their struggle coincides with teacher and student strikes internationally in Greece, Germany, Sri Lanka, and the United States in recent months. The teachers are joined by their class brothers and sisters in every major industry, including healthcare, auto workers, and transport workers, as a global strike wave surges around the globe. In the New South Wales teacher strike, neither the union nor any speakers mentioned COVID because they feared it would reveal that tens of thousands of teachers and students are being herded into unsafe and infectious classrooms. In their battles, workers have been repressed by governments of all political colours and abandoned by the unions, who obey the dictates of finance and big business, oppose lockdowns and elimination of COVID, and bring down strikes as quickly as possible. World War I was ended by the workers taking the struggle into their own hands through the October Revolution. Today, workers must break ties with the lies of the capitalist governments, big business, and the unions, and form their own organizations, rank and file committees, to guarantee their safety and fight to eliminate COVID. The role of the inquest and the call for rank and file committees is to reveal both the need and the method by which workers must ultimately independently struggle to defend their essential social interests. The struggle must be revolutionary, ultimately directed against capitalism itself. A system which kills millions in the defense of profit, including the elderly and young children, is a system which does not deserve to exist and cannot provide a progressive future to the human race. Capitalism's ongoing existence is a life and death matter for workers. There is nothing inevitable about the murderous policies of capitalism. If you agree with our program, we ask you to join the fight. Form rank and file committees in your workplaces to fight for scientific measures against COVID and participate in the inquest. Spread information about the World Socialist Web Site to co-workers, friends, and families, and invite them to our meetings. But most importantly, join the Socialist Equality Party and help build the only independent international force fighting for revolutionary socialism for the working class today. Thank you.
Well, look, thank you, Comrade Gary, for that important and comprehensive report. I think, as you identified at the beginning, one can only describe the approach by capitalist governments the world over to COVID-19 as a criminal conspiracy. The lie that is peddled, that COVID-19 cannot be stopped, is used to justify policies that is now not only allowing the virus to let rip, but covering over the various tools and mechanisms that workers could use to protect themselves, health workers in particular, but also workers more broadly, from catching this virus, whether it be on the question of its airborne transmission or what masks are effective. And I think the fact, as you say, that Paul Kelly, Chief Medical Officer, can make the point that stress not only a herd immunity position, but in fact, one might say, one of the most aggressive stances internationally when the question of Omicron comes up, that is that he wants his ideal Christmas present would be for it to infect the whole population on the completely unsubstantiated claim that it's a milder variant. Nothing will stop the reopening agenda. But I think as you say as well, there's this situation in the public hospitals and facing healthcare workers was not just a product of the pandemic, but exacerbated by it. These public hospitals were in utter crisis at capacity prior to this pandemic. And this destruction of public health is not merely an Australian phenomenon. And in fact, the experience of healthcare workers internationally is very much that same process that the healthcare is being reeled back, that social spending is destroyed, that the requirements of workers is astronomical, long hours, etc. And now they're being thrown very much to the wolves, so to speak. That is, they're at the forefront of confronting the pandemic head on. And I think on that basis, I'm very proud to introduce our second speaker today at this afternoon's forum, Richard Tyler. Richard is a member of the Socialist Equality Party in the United Kingdom. He's a writer for the World Socialist Web Site, and he's one of the coordinators of the National Health Service Fight Back Initiative, or NHS Fight Back Initiative, established by the SEP in Britain. Now, he's joining us today in the early hours of the morning over there. I think it's 5:35 in the UK, so I'm very pleased that you've been able to participate today, Comrade Richard, and again, very proud to introduce you to today's forum. So welcome, Richard.
Thank you, Max, and thank you very much for the invitation to participate in your meeting today. As Max said, I'm one of the coordinators of the NHS Fight Back Initiative here. The SEP established NHS Fight Back in Britain under conditions where the government was seeking to destroy the National Health Service through starving it of vital funds, death through 1,000 cuts, and a creeping privatisation of the most profitable parts. Whenever the British government has introduced even the most limited measures, such as partial lockdowns and mandating mask wearing, it has cited the need to protect the NHS. But the NHS was already facing collapse before the pandemic. Since 2010, the Tories had cut about 40,000 hospital beds in England alone, falling to their lowest number. Bed occupancy is running at well over 95% already, although the safe level is considered to be 85%. Health charity The King's Fund found the UK had only 7 critical care beds per 100,000 inhabitants, compared to 30 in Germany and well over 80 in Austria. Health workers have performed heroically during the pandemic, despite the atrocious way they and the NHS has been mistreated by government. Now, as we approach the end of the second year of the pandemic, the emergence of the far more transmissible Omicron variant again threatens to raise infections exponentially, which, even if it proves less deadly than the Delta strain, will still result in increasing hospitalizations and deaths by sheer force of numbers. It's not about percentages, it's about volume. In one of his first speeches as Health Secretary, Sajid Javid said he thought the pressures currently faced by the NHS were, quote, not unsustainable. A frontline nurse who's a member of NHS Fight Back group told us this was a blatant lie. The UK is experiencing a massive resurgence of COVID-19 cases under conditions of a chronic shortage of staff. This same nurse reported to me just 2 days ago, occupancy at their hospital was now 96%, and there were 164 staff absent due to COVID symptoms or isolating. He told how one of the matrons at the hospital had said that hundreds of nursing shifts were going unfilled each month. In September, there were 650 such unfilled shifts. Not a day goes by without dozens of shifts going without cover, our member said. Now, this was at the end of October, as infections from the Delta variant were rising before the emergence of the even more transmissible Omicron variant. Now, Health Secretary Javid has warned of 1 million cases and even 2 million cases in the UK due to Omicron. Professor Neil Ferguson has reported modelling suggesting that 5,000 Omicron-related hospital admissions a day and possibly 10,000 cannot be excluded. But thanks to the refusal of the Johnson government to do anything real to combat the pandemic, with its ludicrous Plan B only being implemented this week and consisting of nothing but patchy mask wearing rules and a suggestion to work from home for some, while keeping workplaces and schools open, the government has literally baked in mass deaths in the coming months. Various experts, including from the London School of Hygiene and Tropical Medicine, who sit on the Scientific Pandemic Influenza Group on modelling and the Scientific Advisory Group for Emergencies, SAGE, have used experimental data to see how Omicron may transmit going forward into 2022. Even under the most optimistic scenario, one of low immune escape of Omicron from vaccines and high effectiveness of booster jabs, a wave of infections could lead to a peak of more than 2,000 daily hospital admissions. And this would then, as night follows day, lead to anywhere between 25,000 to 75,000 additional deaths in England alone over the next 5 months, according to these models. And this is likely an underestimate, as we've seen in the past. The NHS will be swamped and people will die, not just from COVID, but many other illnesses that won't be treated. In the NHS, waiting lists have grown massively as routine and elective procedures have been cancelled. A record-breaking 6 million are on waiting lists for operations that, while not a matter of life and death, nevertheless often mean being forced to live in unnecessary pain and discomfort. The National Audit Office recently found that despite an additional £8 billion in NHS funding being promised between 2022 and 2025, waiting lists would still likely exceed 7 million by 2025 and could even reach as high as 12 million. The situation is already appalling, heartbreaking even. In November, NHS Fightback received a picture showing an elderly patient lying on the floor in the entry to Bournemouth Hospital's Accident and Emergency Department. Their relatives said that they had been lying there for 4.5 hours waiting to be seen. When we posted this image on social media, it sparked outrage. On the NHS Fightback page alone, it has reached over 5,000 people, with thousands liking, sharing and commenting on the situation created by the UK government. On Twitter, it has been retweeted over 800 times and liked nearly 800 times, with almost 100 quoted retweets. GPs, local doctors, who face massive staff shortages, have struggled to safely maintain their services during the pandemic. This has resulted in increased numbers facing no other option than to attend an accident and emergency unit, leading to longer waiting times in overcrowded A&E departments. Several times over the course of the pandemic, A&E departments have had to declare black alerts, effectively closing their doors and routing patients to other hospitals. A picture similar to the one that was shown earlier in Australia. This is at the same hospital in Bournemouth. As the elderly patient lay on the floor, dozens of ambulances were queuing up outside to transfer patients. A senior clinician said that some handover times were now more than 11 hours. Quote, "They are trying to transfer patients to empty beds in special units, regardless of there not being enough staff to look after them." In October, we wrote an article quoting a paramedic in Scotland who said he had never experienced working conditions like it. Quote, "Even during the height of the pandemic, it wasn't this bad. This service isn't in crisis. The service is totally broken." He went on, "Not a day goes by that myself or a colleague breaks down before, during, or after a shift." So dire has the situation been in the ambulance service up and down the country, in England, in Scotland and in Wales, that hundreds of members of the armed forces have been deployed to assist. Ambulance service providers across the UK report longer and longer delays as record numbers are calling the 999 emergency line. Just on Friday, the BBC reported the case of an 84-year-old man with dementia who had to lay on the floor for 13 hours with a broken hip, waiting for the ambulance to arrive. Even those suffering a stroke or heart attack could wait for 40 minutes before the ambulance arrived. We headlined a recent article on the crisis in maternity services, underpaid, under-resourced and understandably angry. A midwife told our reporter that the maternity services had faced years of underfunding and staff shortages. Community staff were working all day and were then being brought in at night to cover not just home births, but badly staffed delivery units or birth centres, with no consideration given to the number of hours that they might have already worked in a day. They told how community staff were treated like a sticking plaster to cover up all the problems of the unit, even though they were on half the level of safe staffing already. In her words, quote, "That's the tip of the iceberg." She said staff morale was terrible. Not only were experienced midwives leaving the service, but many student midwives said that they would not go on to take up a post once they qualified. And all this will only be magnified now in the months ahead. The National Health Service was founded in July 1948 as part of Britain's post-war welfare state that was supposed to provide comprehensive health and social support from cradle to grave. In the past, it was justifiably held up as the shining example of a publicly funded healthcare system, free to all at the point of delivery, the best in the world. It is being deliberately destroyed now and being brought into being handed over to private profiteers. The present crisis affecting all areas of the NHS are not simply due to the pandemic, but the pandemic has accelerated this process massively, including the handing out of billions in contracts to the Tory party's crooked and scummy friends. Margaret Thatcher came to power in 1979, declaring that there was no such thing as society and promising to roll back the frontiers of the state. And this has essentially been the policy pursued by all governments since, both Tory and Labour, in the interest of boosting the profitability of the major corporations. As I've outlined above, the pandemic is now casting a harsh light on the true state of the NHS. Starved of vital funding, it faces massive staff shortages. In February this year, the health charity King's Fund reported that there was a shortage of nearly 84,000 full-time equivalent posts, affecting key groups such as nurses, midwives, and health visitors. The GP local doctor service also faced a shortage of 2,500 posts, which it was warned could increase to 7,000 in 5 years if current trends continued. As was reported from Australia, that such a high level of unfilled vacancies places an enormous burden on the remaining staff, who face mounting work pressures and burnout. The BMJ, formerly the British Medical Journal, wrote in July that staff burnout across the UK had reached what they called an emergency level and posed a serious risk to the future functioning of services. Under these conditions, the Tory government is now embarking on major changes to the NHS that are designed to further its creeping privatisation and open up lucrative areas to the major health corporations as sources of profits. Under the guise of, excuse me, under the guise of introducing an integrated care system, the NHS is to be streamlined for privatisation. As that mouthpiece of the Tory party and big business, the Telegraph put it, quote, "The private sector will not, as some reports suggest, face banishment from the health service. Rather, a planned, quote, removal of fixed price tariffs might see more private provision if companies can offer better prices." And to make sure that NHS management is fully on board, the government has just recently appointed a former Army General to head up the review of health and social care leadership. General Sir Gordon Messenger, a former Vice Chief of the Defence Staff, has seen operational deployments in Kosovo, Afghanistan, and participated in the invasion of Iraq in 2003. The main thrust of his so-called review is to ensure the NHS has a leadership whose style and context, his words, meet the requirements of the integrated care system and receive the appropriate incentives. In plain English, the NHS must be managed by those who fully sign up to further privatisation and who in return will be handsomely paid. Placing a general in charge of shaping the NHS leadership reveals clearly that for the government, health policy has now become a matter of national security. This can only speak to a development in which masses of people are to be denied access to vital healthcare, which will only be available to those with deep pockets or comprehensive insurance. They are preparing for shortages and deaths and an eruption of social protests in which General Messenger will be working with his fellow generals in imposing a tax on millions of workers and facing down social struggles. So who will fight to defend the NHS and its workforce? The Labour Party, first under the supposed left Jeremy Corbyn and now under the Blairite Sir Keir Starmer, have consistently backed the Johnson government, which is the tool of the most venal and corrupt layers of the British ruling class. Corbyn was privy to the knowledge that it was pursuing a deliberate herd immunity policy of letting the virus spread, but chose to keep this information secret. What of the unions? The picture that I've just put up shows the leader of the TUC on the left, Francis O'Grady, together with the Chancellor, Rishi Sunak, and Dame Caroline Fairbairn, who was the head of the employers' organisation, the CBI, as they announced their tripartite proposals. Like their counterparts in Australia and globally, the unions act as the boss's industrial police force and willing partners of the Tory government in ensuring schools, factories and offices are kept open to ensure the flow of profits. The years of austerity, pay freezes and below inflation increases mean that some health workers have seen their pay decline by up to 20%. In the very midst of the pandemic, while cynically declaring NHS staff to be heroes, the government tabled a 3% pay rise, a real terms pay cut, given inflation set to rise to at least 5% in the next year. But rather than rejecting this insult outright and launching industrial action to secure a real wage rise, the union bureaucracy reached for the first tool in its treacherous arsenal of measures to delay and sabotage any fight, the so-called consultative ballot, first asking their members if they would accept the government's insulting offer. Unsurprisingly, health workers overwhelmingly rejected accepting a further pay cut. However, despite the large percentages voting against the offer in the consultative ballots, turnout was very low. For example, only 25% of eligible RCN members, that is nurses, participated. And this itself reflects the fact that health workers are well aware of the rotten record of the unions in demobilising any struggle and have no confidence in them to lead a fight to secure real improvements. With the government then unilaterally imposing the 3% increase in September, the health unions followed the pattern established in virtually every other dispute here in the UK. The initial consultative ballots of health workers were then followed by a series of indicative ballots. Now, these were not a vote to strike, but a vote to take a vote at some future point on industrial action, which would not necessarily include a strike. As we wrote on this, by dragging out the process, the unions gained time for themselves to grind down the opposition of their members. And this is now what has happened. One of the largest health unions, Unison, has just announced that given the low turnout in its indicative ballot, just 24%, it would not be moving to table a formal industrial action ballot. To do that, the union said, it would have needed at least a 45% turnout. And this follows a similar vote by nurses in the RCN last week. Only the GMB, which represents far fewer health workers, said it would move to ballot on industrial action. Junior hospital doctors were not even included in the 3% pay rise, and their union, the BMA, which sold out the 2016 months-long junior doctor strike, is not even consulting its members on a fight for a pay rise. Here as everywhere, the only thing the unions will defend are the inflated salaries and perks of the bureaucracy, and workers know this. That is why we established the NHS Fight Back as a means to popularise our call for the establishment of independent rank and file committees of health workers. While the unions divide health workers along occupational and geographic lines, we seek to unite them in a common struggle to defend the NHS and its workforce. What is happening to nurses, doctors and other health workers in Britain is happening all over the world. What is happening in Britain now with the pandemic foreshadows what will happen in Australia and New Zealand as governments there abandon even the limited mitigations and open up the economy. Though the number of deaths from COVID in Australia is still relatively small, 2,600 was the figure I saw, compared to an official figure of nearly 150,000 in Britain, although we know it's much higher, Omicron has already hit and will lead to a sharp spike in suffering and deaths. As Friday's perspective on the World Socialist Web Site said, as 2022 approaches, we cannot have another year of mass death. The fight against COVID-19 must be deepened on the political, economic, and social planes. The fight to establish rank and file committees of health workers is a vital part of this struggle, as is the convening of the Global Workers Inquest into the pandemic. Thank you.
Well, thank you very much, Richard, for that critical and detailed report. And as you say, I think the situation, the images in the hospitals are certainly appalling and really create a great shock in those that see it. But I'm sure health workers that are listening to this meeting today here in Australia would see some very direct parallels in their own work, in their own situation that they confront, whether it be the extravagant wait times, massive ambulance ramping, the use of the military in one form or another in health, burnout, amongst other things. And I think your warning at the end, makes very clear the situation that is already beginning to erupt in the health system here in Australia. And now we will open up for questions, discussion, and any contributions as well from workers and healthcare workers or others who are participating in today's meeting. We do welcome as much discussion and going through of the experiences you confront in your workplace as well. We already have a question that's come in from Margaret. She says, Thank you, Richard. Can you outline more of the work of the NHS Fight Back?
Yes, thanks for the question, Margaret. We established NHS Fight Back, as I said, to really fight for and popularise the call for independent rank and file committees of health workers. We set this up initially as a Facebook page, and it is open to anybody, obviously, to like our page and to follow what we're posting there and to get involved in the discussions on our page. Our NHS Fight Back group in Britain consists of many health workers, nurses, doctors, those that work in social care, and in various other aspects of the NHS. I have to say, actually, you're somewhat ahead of us in Australia in that you've been holding these public health workers forums. That is not something that we have done yet, but we are definitely planning to do that in the new year. We use the social media platforms that we have, such as Facebook, Twitter and Instagram, to post articles on health issues from the World Socialist Web Site, to comment on contemporary developments, and to try and engage with those that are active in fighting for the NHS in a dialogue about the policies that we advocate. And some of our posts, such as the one that I quoted on the photograph of the elderly person, did find enormous resonance on social media. On Twitter, for example, I know it was picked up by a doctor here who is very active in social media and speaking out in defence of the NHS and against privatisation, who himself has got thousands and thousands of followers. And now, obviously, going forward, we will be using the opportunities provided by our social media presence to get in touch with such people, to try and win them to make contributions to the Global Workers Inquiry, and to engage with us in a discussion of what is necessary to eliminate and eradicate COVID. I hope that gives you some idea.
Yes, thanks very much, Richard. We do have some more questions coming in. I also say that obviously participants can also ask questions of Comrade Gary's report as well. There's a question from Kerry who said, thank you for these critical reports. I was wondering about the content of clinical presentations on COVID-19 and Omicron within public hospitals, if they occur and if they reflect the science presented. I was also wondering about the opportunity for public health information based on the science to be conveyed on the administration of booster shots as an outcome of rank and file committees. On receiving my vaccine, the information was largely limited on side effects. And then there's another question from Jenny. Is the inquest going to deal with the detail with long COVID? The glaring absence of anything much in the media about the added tragedy of long COVID, afflicting so many people in such a wide range of ways, needs to be countered with testimonies from sufferers and researchers into long COVID's potential long-term side effects and even the shortening lifespan. So thanks for your questions, Kerry and Jenny. Perhaps, Gary, you would like to begin to answer the question from Kerry.
Yeah, it's a very good question, actually. There's a couple parts to it, so I'll answer it that way. The first bit seems to be about whether we're getting clinical presentations on COVID-19 and Omicron, which I assume means that what sort of information are we getting? And the answer is not much. I mean, in terms of a systematic effort to educate the healthcare workforce, both in my experience and what I'm aware of, what I read, it's really been left to individual healthcare workers to mostly educate themselves. I mean, there are sort of, pro forma emails that are sent, out via, the various health services that will, offer links and suggestions of where to go and look things up. And, usually it's more done in a kind of, a sort of directive way. You get an email saying this will be the policy of this hospital, deal with COVID cases from now on, and so on. But very little discussion of the science of COVID, very little discussion as to how we know what we know, and very little encouragement of, widespread discussion and understanding at a mass level within the hospital workforce. And it's certainly well out of proportion to what should be done. I mean, the fact is COVID-19 is the most significant disease in 100 years. And it's not being, discussed in that way within the hospital system. This is not limited to Australia by any means. Of course, individual healthcare workers, I think, are making efforts to get themselves educated. But obviously there's significant limitations when it's not being encouraged in a broad way. Insofar as they are discussed, as I said, I mean, they're not really going into great in depth. It's more about what healthcare workers should do, when presented with a certain, COVID patient. It varies from how to test them properly to, what treatments they might need, to where they need to go in the hospital and so on, but nothing really on the science. And then in terms of the opportunity for public health information based on the science to be conveyed regarding booster shots, would that come out of that rank and file committees? Well, yes. I mean, I think one of the great efforts of the rank and file committees is education. I mean, it's not, and, political education, of course, because as we said, I mean, the reason, COVID isn't being eliminated is a choice that's been made by governments, at the dictates of big business. But it's certainly the case that one of the most important things that we'll be doing as well is scientific education, giving people the actual facts on the ground, helping them understand what is happening with regards to the pandemic. Slightly beyond the scope of the question, but, one of the works that we've done in our Committee for Public Education, the Defence of Public Education, has been to reveal the number of schools that have been shut down in Australia because of COVID outbreaks, which incidentally is not information that's particularly easy to find. Similarly, and it will almost certainly be the case in the coming days and weeks, I think will increasingly become, an authoritative source really for up-to-date information about infections, hospital-acquired infections, and the ongoing, situation with COVID, as governments adopt increasingly dishonest means to withhold that information. Just with regards to booster shots, I mean, let me just say the policy of the party is that, people should get it. It's vaccines are very important. There's significant evidence, as I went through partially in my report, that the Omicron variant is able to partially evade vaccines, that, people who only have 2 doses, are far more at risk of getting a serious COVID infection than they were with the previous variants. Booster shots by no means will completely rectify its situation, but it will give an additional layer of protection that presently is not there with only the 2 shots. And again, in terms of discussing the data and the information behind that, well, yeah, absolutely. I think rank and file committees will play an important role, again, in honestly conveying information. We are very, the importance of vaccines, the fact that vaccines are a vital part of the effort to eliminate COVID is absolutely something the rank and file committees would make known. Of course, it's not just limited to that. I mean, there's lockdowns, there's a need for quarantine, there's a need fundamentally for international cooperation on a massive level in order to eliminate COVID. But yes, certainly that information would be there. And, I think that would have a major impact. I mean, one of the big issues that people have, including many workers have, is that they're not sure who to believe. Governments do lie. Government authorities do lie or withhold information. But, that doesn't, invalidate the scientific method. It doesn't, diminish the importance of scientific measures. But I think the rank and file committees can play a very important role in differentiating between, scientific research and the importance of an objective analysis of the situation with COVID, and therefore, giving an opportunity for workers to see the truth. Yeah. Shall I answer the next question as well? Or?
Well, if you'd like to, Gary, if you want to, on Jenny's question, you mean?
Yes, yeah.
Yeah, okay, if you want to make some points, go ahead.
So the question, we go into detail with long COVID. Well, yes, I mean, one of the things we want people to do really is to come forward with their experiences. I mean, including experiences either of, in the case of healthcare workers, treating people with COVID, or if they've had COVID for themselves or their communities. We do want people to come forward. I agree that long COVID is something that again is not being discussed at length. I mean, one of the really criminal aspects of this idea of herd immunity, let it rip, even when they're discussing Omicron, is this complete omission, really, of long COVID. And we have had interviews with people on the World Socialist Web Site, but it really highlighted long COVID is devastating, basically, and a significant proportion of people get it. The rates and the severity of it do vary to some extent between different groups of people and the variant of COVID. But overall, it seems the evidence is at least 25% of people who get COVID are going to have symptoms that last greater than 3 months. And a significant proportion of those people get symptoms that may last, have lasted essentially for the duration of the pandemic from whatever point they've gotten it at. And so I think, that's something that's obviously been neglected. And when people are speaking, for example, of Omicron being supposedly a milder variant, universally in those descriptions, they leave out long COVID. They speak exclusively in terms of deaths, but you don't need to, in that sense, deaths are not the only aspect of COVID, the impact of long COVID, which is many more times the number of people that have actually died of it, is going to be something that, it will be a multi-generational problem. And again, it's another aspect that needs to be brought forward. So yeah, certainly the inquest is going to go into it, both the science, which we have done as well in the past in the site, but also, yes, we're going to try to bring people forward, and we encourage people, if they have experiences, knowledge about it, information, that they should come forward to the inquest. Absolutely.
Thanks, Gary. And in the comments, the chat section, you can see Julia has posted a link to a recent article we've had on the UK teachers with long COVID welcomes Global Workers Inquest into the pandemic. We have 2 more questions that I will read out and then open for more contributions. And as I said before, on that first question from Kerry, I mean, other health workers can also begin to answer those questions in their contributions, and also the question from Jenny. So we have a question from Campbell saying, can Gary or Richard comment on the trajectory of using the pandemic to cover the drive to privatise medical and health support mechanisms, and what effect privatisation in health and education will have on the working class? Thank you. Is the question from Campbell. We also have a question from Jenny. How do people come forward? I'm assuming that means for the inquest. I will get our tech team to post in the chat the email that you can send to us to let us know that you want to get involved. There's also a link on the website. We will put that on the screen in a slide further on in the meeting. But very much so, there are many ways to get involved. So did Gary or Richard want to begin to answer Campbell's question? Maybe Richard, did you want to start?
Well, as I indicated in my comments, the question of privatisation is very much at the heart of what is going on here in the proposals that have been brought forward by the government. I mentioned the integrated care system. We've now, one aspect of that is the setting up of these integrated care system boards, which from which representatives of the private providers in healthcare and other private corporations are not to be excluded. So it is very clear that in the plans of the Tories, what they want to do is carve out all the most profitable bits from the NHS that can provide, a lucrative goldmine, really, for the private health providers. And I mean, right from the very start, we saw this, for example, on the question of PPE, where, at the start of the pandemic, despite having been warned in a government exercise, Operation Cygnus, that had taken place, I think, a year or 2 years before the pandemic actually started, on the critical role of having adequate PPE stocks. These had been run down or were so out of date that they were virtually useless as the pandemic started. And then the government awarded contracts outside any sort of formal tendering process. You know, and you had cases, I mean, you know, the ridiculous case of somebody who was a chum of the then health secretary who ran a pub, who set up a business supplying PPE and won some sort of contract. I mean, it is just pandemic profiteering is what we've seen in the field of diagnostics. A lot of that has been outsourced. And I mean, just the question of the vaccine itself. I mean, these vaccines were developed basically through the input of billions of pounds of public money. I mean, here the Oxford AstraZeneca one, and these private companies are making a killing. You know, on the stock market, their shares have risen enormously, and rather than, you know, making the intellectual property rights of these vaccines free for all nations to be able to, you know, make the vaccine, they're maintaining their grip over the formulas and everything to maximize their profits. I mean, what we are heading towards, I think, is, you know, a system like the United States, where there will be an absolute minimum of health provisions for the poor, for people that can't afford any sort of adequate health insurance, and everything else will be scooped up by private companies. I mean, you have them operating over here. Richard Branson's Virgin already runs a number of aspects of the NHS, including walk-in clinics in many cities, here in Sheffield included, I think. And what we can see also from the States, I mean, it's interesting, in Britain spends, I think, about $4,000 a head on health. In America, it's $10,000 a head, and that is not, for by any standard, a better system. You know, this is money that is going to line, you know, the pockets of the shareholders of the major health corporations. And what the experience for the working class will be under that. I mean, you know, I can remember being told by my grandma what it was like before the NHS, you know, where if you needed to see the doctor, you had to have £0.50 in order to be able to pay him. And if you didn't have the £0.50, you couldn't see the doctor. It was as simple as that. So this is, you know, what is on the cards now.
Richard, just while you're speaking, there's another question that's come through for you from Carol. Just wondering if you could answer that as well. It says, Richard, what role is the Labor Party playing in relation to the privatisation of the NHS? I think some of the early attacks began under the war criminal Tony Blair, paving the way for the Tories.
I mean, the Labour Party are the de facto coalition partners of this government. Johnson is going to put his so-called Plan B, which, as I indicated, you know, is the most minimal and really inadequate measures, such as calling for more mask wearing in, you know, a number of places, such as now shops, pubs, restaurants, and so on. Ridiculously, you have to wear a mask in church, but then you can take it off if you start singing. There's been reports in the press of up to 60, I think, Tory rebels who are not going to support Johnson, you know, because they just think it's ridiculous. They want the virus to be let rip. They support this whole, you know, lie that Omicron is the mild version and that everybody should just get it. And so Johnson, I think the vote is going to be on Tuesday this week. Johnson will get his legislation passed because the Labour Party will support it, basically. And even under Corbyn from the start, Labour has offered what it called constructive opposition. In other words, full support for the Tories. And in terms of privatisation, I mean, Labour, when it was in office, oversaw a system called the Public Finance Initiative. This was introduced by Blair, and this basically meant that the building of things like new hospitals was then not undertaken by the public sector, and that these hospitals, you know, if you like, belong to the NHS, but the hospitals were built by private companies which then leased them to the NHS on, you know, 20, 30-year contracts where they were also responsible for all the maintenance and all the, you know, technical side of provision, ensuring them really a steady flow of profits. So Labour is fully signed up, you know, to the market. It is a pro-market party, and workers can really not expect any fight from Labour, any serious fight against privatisation.
Thanks again, Richard. So we do have some more questions. Well, we have a comment that's come in from Julie Rodgie, who says, I'm all for vaccines as a former registered nurse, but I'm very reticent about getting Pfizer at my age because of the cardiac problems that can occur. A close friend of mine's son at age 48 had significant pericarditis, sorry if I pronounced that wrong, and will probably continue to experience this in the future. As my age is 65 and I have significant health problems. I have had my first 2 shots though. So to begin to comment on that comment from Julie, as well as to discuss the question of information provided on the question of masks, among other things, I'm very pleased to welcome back again John Brennan, who is the associate professor at the University of Newcastle. He spoke at our last health forum, Health Workers Public Forum, and so we're very pleased to welcome him back. So go ahead, John.
Thank you very much, Max. I actually might just answer that question from Julie first. And I at the last Health Workers Forum, I spoke on vaccines, and a similar question was raised. And look, the concerns for the side effects are understood. They do exist. I've just had my my 3rd shot being a health worker, and you know, it hasn't gone without side effects. But one of the aspects of just the general side effects that exist, of course, that's an indication that your immune system is responding and building immunity. But the side effect that Julie speaks of is actually one that's of concern, and that's usually limited to the messenger RNA vaccines, such as the Pfizer and the Mrna vaccines. And the pericarditis that exists can be identified on the first vaccine, and in some cases, of course, it's not pleasant and the patient is admitted. However, the patient doesn't get that vaccine again. They will get a non-mRNA vaccine, and from what I have understood, that is the way forward, because of course, without these vaccines, the risk of mortality to catching this infection are quite significant. And so there is a clinical strategy around this particular side effect. So it can be managed. I mean, last I heard, there's no reported deaths to the mRNA vaccines in Australia, and the last I heard some months ago was you know, in relation to these mRNA vaccines, it's quite remarkable in that the numbers of people that have been given these vaccines, there's still no reported deaths worldwide, and that was again, that was some months ago, and I haven't heard of any since. I was just going to make a comment in relation to face masks, and I think it's a timely thing to remind ourselves, considering you know, the upsurge of these infections internationally, the arrival of the Omicron, and of course the policies that we're now exposed to here locally, where there's going to be a lifting of many of the policies that were around to limit the spread of the vaccine that are coming into place. So that dovetailing with this rather new upsurge of infections that we're seeing here, I think a reminder of the importance of face masks is rather vital. I just want to point all listeners to what was mentioned in Gary's, the excerpt that Gary highlighted in his talk from Nicholas Smith's testimony that was published on the WSWS on the 27th of November. That is compulsory viewing in my view. He is remarkable in the manner with which he is able to explain from a scientific perspective the value of these masks, but also as importantly, how the information around these masks has been used politically and of course, by not instigating good quality masking early on, government policy has allowed the pandemic to advance. So effectively, cloth masks are something that people have great access to. They can be purchased, but they're not medical masks. And they sort of fall into a similar category to surgical masks in that both these masks are loose fitting. So they're disposable, and they create a physical barrier of the mouth and the nose from potential contaminants in the immediate environment. So if they're worn properly, and properly means, covering the face, however, there is usually a gap at the side of the cheeks, they will block large droplets or splatter that could contain virus that the wearer might be, where the barrier may prevent this. Now, of course, on the understanding that the virus is aerosolized, these have limited efficacy, and this requires an understanding of the need of an N95 mask. And again, Nicholas Smith's report covers the science of these very, very well, because they're not just about, they're a very complex barrier, and they have a full face shield in so much as they can tightly go around the face, and they preferably come up and are attached to the back of the head. However, they can come with ear supports, but again, you really need to make sure that there is a proper fit around the face so that there's no leakage. And so these N95 masks are used in hospitals, of course, although in hospitals we are fit tested, because not every N95 mask fits every single face. And so there's quite an elaborate testing procedure in the hospital system. And of course, we also wear goggles with the understanding that the eye can be exposed to the virus, and that may be a point of entry of the virus. And so in environments where we know we're walking into COVID, such as a clinical environment, the N95 mask and goggles at the moment are mandatory in a clinical environment. So now accessibility is really quite important. And some of the N95 masks that are available to the hospital environment are not easy to get out in a sort of a commercial setting, such as a shop or eBay, but there are similar masks. And there are studies that have demonstrated that if you use, for example, a cloth mask over a surgical mask, you can increase that barrier and decrease the ability of infection. However, comfort is important, of course, but these are some ways with which one can increase the barrier between an exposure and protection from an aerosol containing a virus if the N95 is not available. However, the N95 mask does remain the most effective, a tight-fitting N95 mask. And again, I really should direct you to Nicholas Smith's testimony, where he does explain quite clearly the efficacy of these masks and their benefit. So I will I'll leave it there for now, Max. And if anyone has any questions, I'd be more than happy to answer.
There is another one for you, John, while you're there. Maybe you could give a quick answer to. It's from Jenny, saying, what about if you have the mRNA vaccines as a booster? So I guess presumably you have the mRNA, you haven't had those vaccines previously, and now you're getting that as a booster. Maybe you could.
Yeah, yes, absolutely. There is some evidence that if you swap some of the vaccines from, you may get additional protection, but I think the additional protection really is not the discussion I when I heard this discussion, one of the ways of thinking was that really a third vaccine is more important than the mixing and matching of a vaccine. And for one to do this, you really need to understand the literature in terms of what combination is better. But really, at the end of the day, it's probably not going to make a huge amount of difference in knowing that the booster shot, which is called a booster, but in actual fact, this vaccine does require 3 for at this stage for the most optimal protection. 3 of the same vaccine is probably going to give you as superior protection as if you were mixing and matching.
Look, thanks very much, John, for your contribution. Always welcome at our meetings. We have some more discussion and some more indications to answer some questions, and I will call on some other people to begin to answer some of the questions. But just before that, I'd like to make just some announcements on our literature sales, because I'm very happy to announce that we have at the moment a store-wide 20% holiday discount on all the Mrna book titles that you can purchase. So it's titles from Mrna Books on our website at Mrna Books, just mrna.com.au. The link will be placed in a chat. So now, at the holiday season, there is no better time to build your Marxist library. And I want to just promote a few books today. So the first one is the Historical and International Foundations of the Socialist Equality Party Australia. Now, this book reviews the critical political experiences of the Australian working class throughout the 20th century, as we say, within the context of the global economic, political, and social processes. It delineates the struggle for Marxism from all varieties of national opportunism, in particular, the nationalist doctrine of Australian exceptionalism that has been promoted by the Australian Labor Party and the trade unions for more than a century. It is an essential book for study for anyone and is required reading for full membership of the party. On your screen, you can see that with the 20% discount, it's not $15, but $12 plus postage and handling. So a great deal that I encourage people to purchase. The next pamphlet that I have want to advertise today is the pamphlet entitled The Global Pandemic, the Class Struggle and the Tasks of the Socialist Equality Party. This contains the resolution adopted at the 6th National Congress of the SEP in the United States. And this is an assessment up to the point of August 2020 of the development of the pandemic and the class struggle. It is a critical document and resolution. It's $5 plus postage and handling. And finally, I'm very pleased again to announce our pre-orders for a new, soon-to-be newly published book in Australia, which is called Was There an Alternative? This is the first in a 7-volume series from Russian Marxist historian Vadim Rogovin. It analyses and traces the complex inner party struggles of the left opposition, in particular in 1923 to 1927, against the bureaucratic degeneration of the Stalinist bureaucracy. I mean, this book is at a very reasonable pre-order price of $36, down from $45. You can also get the e-publication for just $12, down from $15, as part of this holiday discount plus postage and handling. There are many other books on the site that I really, as I said, encourage people to have a look and explore. And now is the time. 20% off. That's between now and I believe the 6th of January. The sale is on. So now is the time to build your Marxist library. So find the links in the chat and go through to purchase those. So to mrna.com.au. To answer Campbell's question, particularly on the question of privatisation, which it answered well on the question in the UK, but particularly here in Australia, I'll call on Comrade Margaret, who is a leading member of the health group and a writer for the World Socialist Web Site, on healthcare. So hand over to you, Comrade Margaret.
Thank you. Look, on the question of privatisation of health, Richard brought out about the Blairite PFI initiative in Britain. It is replicated here in Australia, where it is known as public-private infrastructure, and also PPP. Recent examples in health replacement hospitals, such as the Bendigo Hospital in Victoria, the Royal Adelaide Hospital in South Australia, or a new hospital, the Victorian Comprehensive Cancer Centre. But a new one, these ones have been completed, and they were all around about the $1 billion mark. A new one, and the signature project, is the $1.5 billion new Footscray Hospital, which is in the process of being constructed by a consortium called Plenary Group. These latest developments have largely been under state Labor governments. And I just want to go into it slightly. The whole way that this has occurred is privatisation by stealth and enables the looting of the public purse. The mantra from the industry is that governments are using PPPs to offload financial risk, but this is belied by the record. When the 2008 financial crisis hit, the Victorian Labor government threw money at the various PPP projects in the pipeline to offset the difficulties the private companies would have in borrowing money, because governments can borrow money at lower interest. The sway of this industry over the public health system has been dire. And last year there was an indication when Sir Rod Eddington, the chairman of Infrastructure Partnerships Australia, which was the body set up by the state Labor governments of Victoria and New South Wales in 2005, he stated that the then Melbourne lockdown against COVID should be shelved. He said, total lockdowns across Melbourne are a blunt instrument. We have to find a way to protect lives and livelihoods, and to do that we're going to need to be much more targeted about where clusters occur, and that can only happen with an enhanced tracing regime, testing and tracing regime. In other words, you know, close down lockdowns because they're not suitable for business or acceptable to business. And the whole privatisation approach, you know, is very sinister and has been, you know, operated under the guise of getting new hospitals for the community, which is not what they're about at all. They're basically looting of the public purse.
Thanks very much, Margaret, for that answer. And there are, and we will post in the chat some links to some articles on some of these questions, including the article written by Margaret on the linking, and we'll go into this later, on the question of the public hospital crisis and Australia's anti-democratic laws, which also deals with some of the history of this privatisation in Australia. I will call again on John to answer. There's been some clarification. Jenny's question of about the RNA vaccines as a booster was just to clarify on the hard issues that were raised before by Julie. That is, will the RNA vaccine impact or contribute to heart issues? And then also a question from Julie following up. If I had my first two of AstraZeneca, what if I can't get it for the booster, John? So perhaps, John, if you wanted to answer those two questions.
Yeah, absolutely. I would look at, again, in principle, if the AstraZeneca wasn't available, another vaccine would work. It wouldn't, as far as the data that exists on mixing and matching, there is additional immunity. I mean, if there's any concerns about this, of course, you should raise it with your GP if the GP is going to be administering it. But yeah, if there's I mean, supplies can be an issue, but as I'm not sure that would be something of a significant concern. I was just going to, I think that just to, yeah, Jenny's, it was just an addition to Jenny's question that was worth commenting on. So there isn't any evidence that the mRNA boosters will increase the risk of heart issues. If there were no problems with the first 2 doses, it's very unlikely that side effects would increase on the 3rd dose. And that's, it's usually from, I mean, these issues in relation to the pericardial inflammation is often occurs on that first dose, and it's very clearly identified. And again, then these patients are not given that virus again. They're given another one, such as the AstraZeneca vaccine.
Thanks very much, John. I'll now call on Comrade Cheryl Crisp to speak. Cheryl is the National Secretary of the Socialist Equality Party. She chaired the last Health Forum, as I'm sure everyone here recalls. So very much welcome, Cheryl, to speak. Go ahead.
Thanks, Max. And look, I think the questions, the discussion today is immensely important because, well, just as the role of the inquest in what is a turning point in the development of the pandemic is so important. And I think the points that the speakers have made are very important. I mean, what the inquest is briefed to carry out is to provide the information for hundreds of thousands, millions of workers, not just on what the course of the pandemic is, how it developed, but who was responsible, who needs to be brought to book for the development of a 2-year pandemic about which we're entering the 3rd year, and entering that 3rd year with a 4th wave, increased infections, increased deaths, and an experience in which the information, the knowledge which has been provided by the media, by governments, by the unions, has not just been substandard, but has really, there have been immense ongoing lies and misinformation. And this is not an accident. It is not something which arises out of the perfidy of individuals. Of course, they are responsible, and what they do has real consequences. But this is a class response, and I think the importance of knowledge, of the truth, of information to the working class, and the revolutionary character of that issue, I think is seen by the decision that the British courts made in regards to Julian Assange. I mean, this is a man whose crime it was to provide information to the masses. What he did was he didn't allow it to be buried. He didn't allow it. I mean, all the governments knew about it. The military knew about it. The many sections of the media knew about the crimes in Afghanistan and Iraq. That it was not the fact that the crimes were being carried out. It was the fact that those crimes became the knowledge of the masses. And for that, Julian Assange has been the subject of the most profound conspiracy and attack for more than 10 years now, in which he now faces the prospect of being extradited to the United States. The British government is not only allowing but facilitating that. The Australian government which is the government of his citizenship, has stood back and allowed a citizen to be subject to torture or virtual torture, to persecution, to intimidation, to being locked up, and has lifted not a finger. This is the attitude that governments have to the knowledge, to the rights of the ordinary people, of the masses, to knowledge. What is happening to Julian Assange, in that sense, is the sharpest expression, the most egregious expression of the attitude to the knowledge that is required by the working class, by broad sections of the population, on every aspect of life, but most importantly now on the pandemic. I mean, it is now clear, as I said, going into 3 years, the third year, that this is a ruling elite which is allowing the pandemic to proceed indefinitely. The analogy to World War I is so apt. By the third year, the death toll of World War I was increasing exponentially. Not only was there no end in sight, but the slaughter was accelerating and developing at a pace which showed no indication that the ruling class or any of the participating countries and nations were going to pull back. And let's remember, one of the reasons that the Spanish flu pandemic was able to spread, develop, get hold, and cause untold death and destruction was because the warring parties, all the warring parties, kept the Spanish flu, a secret. And the reason they did that was because the prosecution of the war was far more important than the required measures, which were not all that fundamentally different to what now has to be undertaken. Lockdowns, mask wearing, vaccination, contact tracing, all these measures, which of course were being done at a very far greater primitive basis in 100 years ago than now. But that's one of the reasons that the Spanish flu was able to get such a hold internationally. What you have now is decisions that life expectancy being reduced is actually a good thing. That's a benefit. The elderly being cut down, dying in huge numbers is a benefit because that saves them money on welfare. The fact that now children really face a life and death question and their parents face a life and death question by actually going to school is an expression of what the attitude is of capitalist governments to the life, wealth, health and well-being of the vast mass of the population. The inquest itself is designed to provide to ordinary people, to workers, the information on the pandemic, on how it spreads, on what is required to contain it, and as I said, on who is responsible. It is also to provide a perspective on how it is to be stopped. And the war measures being prepared and accelerated against China have not a small degree bound up with the very fact that China has in fact proven that the pandemic can be stopped. The pressure being exerted upon China, and we have great disagreements and opposition to the perspective, the political perspective of the Chinese regime. But what that country has proven by the allocation of massive resources whenever an outbreak emerges, what is undertaken there, and the inquest and the World Socialist Web Site will go through this in detail, is the allocation of community trackers, of community health and public health authorities, in which people are not just on their immediate contact, but where infected people have dined, where they have been, who could have crossed paths with them, contacting those people, how they're organising lockdowns of cities, of communities, and ensuring that food is provided. It requires the allocation of enormous social resources, and that allocation is something which capitalist governments have now declared nothing is going to require the diversion from any resources going to the coffers of big business, of the ruling elite and of the rich, to facilitate the stopping of the pandemic. So the fact that within 2 days, on the 15th of December, all restrictions in New South Wales cease. Masks will no longer be mandatory. There will be no restrictions on the number of people who are able to gather together. Already, we're seeing pubs, clubs, Christmas parties, the source of dozens of infections. New South Wales is rife with Omicron. The borders are being opened with all the other states. There is, and the declaration by Liberal and Labor governments is, it doesn't matter what the infection rate is, it's what the hospitalisation rate is. And it doesn't matter what the infection rate is, because borders won't close again. There will not be lockdowns. And so what the fight of the pandemic is part of the mobilisation of a movement against these measures and for the end of the pandemic. It is on a par with the anti-war movement which developed in 1917 in Europe against the war. And it was that movement that took its most profound and conscious expression in the Russian Revolution of 1917, which itself ended the war. That is what we are fighting for with this pandemic, with this inquest into the pandemic. And so I think that when one looks at the measures that the International Committee is undertaking, it is, as we have said, these aren't just health measures. This is not a health crisis alone, but a political crisis. And what has to answer that are health measures, but there is only one force that can actually implement those health measures. If anything has been proven by that, it is the last 2 years. And that force is the working class. And that force requires a perspective. And so I think the importance of the issues that the speakers have raised, and the outline that Richard and Gary and others have put forward about what is taking place in these different constituencies, different countries, is that there is an international experience being undertaken by the working class. The conditions, yes, they're not identical, but the policy of governments is the same. And so workers themselves have to join together in an international movement to fight for the end of the pandemic, which itself is going to require a political perspective in opposition to the unions, in opposition to Labor, in opposition to all those forces that the pseudo-lefts promote and put forward as pressuring governments because they cannot be pressured. And so that is one of the reasons why we certainly urge anybody here who is not a member of our party to join, and to also participate in our ongoing fight against the electoral laws, which are themselves another measure of the attempt to silence workers and suppress their opposition. So I think that the discussion is very important. The questions are very important, and we also have to draw conclusions. Thanks.
Thanks very much, Comrade Cheryl. I mean, with those remarks and noticing the time, we are going to have to begin to draw the discussion to a close. We'll read out the final comments that have been made. There was one from Kerry who said science-based information should accompany booster shots or vaccinations. Compliance with vaccinations is a pathway to further education. Masks, aerosol, physics, public health science. The great mass of the population are turning up at a healthcare centre. An enormous opportunity to educate the public. I understand the importance of rank and file committees to this wide initiative. And then the question comes up straight away with your point, Kerry, why is it that they are not being educated? Why is it there this mass education of the population? I think Cheryl's contribution, as well as others, makes very clear that an essential component of the homicidal herd immunity policy is lies and misinformation in order to justify the reopening agenda. Jenny's question, should the inquest have its own title section on the World Socialist Web Site so people can easily find articles about it? It's currently under the coronavirus pandemic topic section. I mean, perhaps it will in the future, as it builds, have its own topic page as well. But if anyone's looking for information on it, or indeed any of the various topics on the coronavirus pandemic, including our critical webinars that we've held recently, that's all found under the topic page of the coronavirus pandemic on the website. We will finish up soon. I just wanted to ask, did Richard or Gary want to make any remarks before we conclude the discussion?
Shall I go first then? Just, I think I would echo what Cheryl has just said about the importance and the value of such forums, and it's very encouraging, here in Britain to hear, the contributions that we've had from comrades and supporters in Australia. And one of the things that we've noted on our NHS Fight Back page on Facebook is that it's not just the articles that we post about what's happening in Britain that receive a lot of likes and a lot of comments. More often than not, the articles that we post relating to the international developments are the ones that really spark an interest and unleash a lot of discussion. And so I would, echo the call for, people to come forward and participate in the Global Workers Initiative. When you speak, you're not just speaking for yourself, but you are speaking for millions of workers around the world. And reading the comments, I know, from workers internationally is an enormous source of strength and encouragement to workers that we've seen in a whole number of struggles that have gone on recently. The whole industrial struggles in the United States. The support that has been won internationally for these has been enormously important in developing the rank and file committees. We may work in different countries, but we all face the same class enemy, and the initiative for the Global Workers Inquiry is really unique in that regard. With the resources that we have at our disposal, we are really providing a platform for the working class to speak out, to break through the knowledge embargo and for workers internationally to speak to each other, to share their experiences, and as Cheryl importantly says, to draw the political conclusions of what is required today. Thank you.
Well, thank you, Richard, and thank you again for getting up so early in the morning to participate in our forum today. Your report, contribution, and answering of questions have been invaluable for the discussion today. Did you want to make any final quick points, Gary, before we move on to some announcements?
No, I didn't have much to add. I mean, I think it's just to say, that I strongly support and fully agree with everything that the other comrades have raised in the course of this meeting, and to really emphasize the need for everyone here, particularly those who are not in the party, to take an active role. I mean, this is a revolutionary crisis in the sense that there is no progressive alternative to the current pandemic, to the crisis that's caused by capitalism, and it extends further than that. I mean, we've raised some of the other issues as well. The extradition of Julian Assange, looking more broadly, the climate crisis, the danger of war, all these problems that really arise from the capitalist system that affect all of us, that endanger the lives and the futures of all of us. They need a deep and thoroughgoing solution. That's revolution. That's the need for a socialist system that will actually put human need over profit. When we say those words, I mean, this is the reality that we're describing. I mean, here you have, in the case of COVID, a disease that's entirely eradicable, that's killing millions. And it's doing so because it's being allowed to do so. You couldn't invent a worse possible response to COVID than what's been organized by the vast majority of the capitalist governments all over the world. And that should say to people that they've got workers, really, they've got to take the struggle into their own hands. And I think as health workers, especially, we have both a special opportunity and a special responsibility to commit to that struggle. I mean, anyone who becomes a health worker does it because they want to help people and make a positive contribution to humanity. Well, in our era, in our time, that's contributing to the revolutionary struggle, because that's really the most important thing, to preserve the health and welfare of the entire human race. So to make those points.
Well, thanks. Thank you, Gary, for those remarks. So we'll bring the discussion to a close and finish with a few announcements. Firstly, as I indicated at the beginning, I would like to, just if we can put on screen, because there's been some questions about how to get in contact with us. I believe we have a screen. Here we are, yes, to get in contact with us on the question to participate in the Global Workers Inquest. You can email us at sep@sep.org.au or to directly message the health workers, that is the health workers group of the SEP. You can message us at sephw.aus@gmail.com. Again, those will be placed in the chat so that you can write those down, send us an email, and get in contact with us and join this critical workers' inquest. I'd like to now raise an appeal to you for a collection for the Socialist Equality Party's monthly fund and for the World Socialist Web Site. On the screen, you can see for Australian residents, you need to go to the sep.org.au website. For international viewers, you can't donate directly to the SEP Australia, but you can donate to the World Socialist website, wsws.org. I mean, every month we raise our monthly fund entirely from the working class and young people. We don't get money from corporations or the state apparatus. It is always raised from our supporters. And we've reached our monthly fund for nearly 50 years. The fund goes to maintaining the World Socialist website, our social media platforms, and the continuation of our work through the working class. And with this critical workers' inquest, this work needs to be expanded and developed. And for that, we need resources. As we've discussed today, there is constant lies and misinformation being spread about COVID-19. with the coverage, media coverage, telling the population they need to learn to live with the virus. And it is our party alone that is calling for a socialist program to eliminate COVID-19. And to spread this truth, which is something that is, Cheryl and others have said, is absolutely critical. We need more resources, and it can be a one-off donation, or you can make a pledge to our monthly fund. And we are moving into the difficult holiday season or silly season in which with the holidays at the end and New Year, it can be difficult to get the fund over those days. So we must get it in early. So I really do ask for the most generous donations for this holiday season to take us over December and January and bring us into 2022, in which we will fight to bring this perspective forward, both here and internationally, and in particular with the upcoming election, which will certainly be a crisis election in this country. So if you can, as many are indicating in the chat, please make your donation and indicate what you're donating in the chat. It will be counted. But in relation to the question of the upcoming election, I mean, I also want to make an appeal to all of those here today who are not already to join our party as an electoral member. Comrade Cheryl has already begun to go through some of the aspects of the anti-democratic electoral laws. They were passed in August 26th by the coalition, supported lockstep by the Labor government. They target the SEP and 35 other political parties without seats in Parliament, and required a submission of 1,500 membership lists, treble the previous number, or face deregistration, which means the party would lose the basic right to field candidates under the party name on the ballot paper. Now, this was passed during the height of the worst Delta surge in the country, meaning we're unable to safely campaign. Now, the cutoff date for the submission has passed, and we've not met this arbitrary requirement of the AEC, but we did submit our list and have already won a significant number of new electoral members. And our campaign is far from over. We will continue up until and beyond the looming election, which will really be an election, a crisis election like no other. So for those of you today who are not already electoral members of the party, I really encourage you to sign up. In the chat, you will see a link will be posted for the electoral member sign-up form. But above all, as Cheryl indicated, we really do urge all attendees today to purchase and study a copy of our Statement of Principles, which I believe is in the next slide, and consider making the most important decision of your life to join as full members of our party. Contained within the Statement of Principles are the essential, critical, historical and political lessons of the 20th century that must be assimilated in order to become a full member of the party. And so I really do encourage everybody here today to make that purchase. It is discounted, it's on Merriam Books. Make that purchase today and consider making the most important decision of your life to join as a full member. And with that, I would like to again thank our speakers, Gary Mrna, and of course, Richard Tyler, as I said, who tuned in very early in the morning. I thank both comrades for their important report and contribution. And I also thank the other contributions from John Brennan, Margaret, Cheryl, and above all, I thank you all for your participation and discussion in the meeting today. It's been invaluable and it's been really important. And now we have to take this fight forward with the Workers' Inquest. So thank you everybody for joining today.